A resident begins to choke during mealtime but can still cough forcefully. What should the CNA do first? A. Begin abdominal thrusts immediately. B. Encourage the resident to keep coughing. C. Call the nurse and wait. D. Offer a sip of water. Answer: B. If a resident can cough forcefully, they should be encouraged to continue, as coughing is the body's most effective way to clear an airway. Abdominal thrusts are used only when the airway is completely blocked. When responding to a fire in a resident's room, the CNA's first action should be to A. Extinguish the fire. B. Rescue the resident from the area. C. Activate the fire alarm. D. Close all windows. Answer: B. The RACE method requires rescuing residents first. Safety of residents is always the priority before activating alarms or fighting the fire. A resident suddenly collapses on the floor. The CNA's immediate response should be A. Call the nurse and stay with the resident. B. Move the resident back to bed quickly. C. Apply restraints to prevent further injury. D. Leave the area to find help. Answer: A. The CNA should call for help and remain with the resident to ensure safety until medical staff arrive. Moving them without assessment may cause further injury. Which is the safest way to identify a resident before giving care? A. Ask the roommate. B. Check the wristband and confirm with the resident. C. Rely on memory from earlier. D. Ask another CNA. Answer: B. Proper identification involves checking wristbands and asking the resident to state their name, ensuring correct care and safety. What is the CNA's main role during a tornado warning? A. Move residents near windows. B. Keep residents calm and follow emergency plan. C. Evacuate everyone outside. D. Continue routine care normally. Answer: B. CNAs should follow the facility's emergency procedures, moving residents to safe areas and helping maintain calmness. Which is the safest way to transfer a resident who is weak but can partially bear weight? A. Use a gait belt and assist with standing pivot. B. Drag the resident across the floor. C. Allow the resident to hold on to your neck. D. Lift without any equipment. Answer: A. A gait belt provides stability and reduces risk of falls, making it the safest method for partial weight-bearing residents. The CNA notices a frayed electrical cord on medical equipment. What should they do? A. Ignore it until the supervisor arrives. B. Continue using the equipment carefully. C. Report it immediately and remove from use. D. Try to tape it securely. Answer: C. Damaged electrical cords are a fire and shock hazard. They must be reported and removed from use right away. Which is an example of standard precautions? A. Wearing gloves when providing oral care. B. Only washing hands if blood is visible. C. Avoiding hand washing when wearing gloves. D. Sharing PPE with coworkers. Answer: A. Standard precautions require gloves for any possible contact with body fluids, and hand hygiene is always necessary. When assisting with oxygen therapy, the CNA should never A. Keep the tank upright and secured. B. Remove kinks from the tubing. C. Place the oxygen near open flames. D. Check for comfort around the mask. Answer: C. Oxygen supports combustion, so flames, sparks, and smoking must be kept far from oxygen sources. A resident with dementia attempts to leave the facility during an evacuation. What should the CNA do? A. Physically restrain the resident. B. Redirect and calmly guide the resident to safety. C. Lock the doors to keep them inside. D. Ignore the behavior to focus on others. Answer: B. Calm redirection helps ensure safety without escalating distress. Restraints and force should be avoided unless ordered in emergencies. The CNA finds a resident unconscious in the bathroom. What should they do first? A. Call for help and check responsiveness. B. Carry the resident to bed. C. Give them water. D. Try to wake them by shaking hard. Answer: A. The first step is to call for help and check responsiveness and breathing while ensuring the resident is safe. What is the safest way to handle a resident's personal belongings during an emergency evacuation? A. Leave belongings behind and focus on safety. B. Pack everything before moving the resident. C. Ask the resident to carry their belongings. D. Hide valuables until after the emergency. Answer: A. In emergencies, the priority is resident safety, not possessions. Belongings can be recovered later. Which action by the CNA helps prevent resident falls the most? A. Keeping frequently used items within reach. B. Turning off all lights at night. C. Requiring residents to walk without walkers. D. Placing furniture close to walking paths. Answer: A. Keeping personal items nearby prevents unsafe reaching or climbing that could lead to falls. If a resident reports smelling gas in the facility, the CNA should: A. Light a candle to confirm the smell. B. Report immediately and avoid using electrical devices. C. Ignore it unless multiple residents complain. D. Attempt to fix the gas source. Answer: B. Gas leaks pose explosion risks. Reporting and avoiding sparks or electricity is essential for safety. During a seizure, the CNA should: A. Hold the resident tightly to stop movement. B. Place a hard object in their mouth. C. Move harmful objects away and protect the head. D. Leave until the seizure ends. Answer: C. The priority is protecting from injury during the seizure. Restraining or putting objects in the mouth is dangerous. What is the CNA's role in infection control during wound care? A. Change dressings independently. B. Hand supplies to the nurse using clean technique. C. Reuse gloves if they look clean. D. Skip hand hygiene if only observing. Answer: B. CNAs do not perform sterile procedures but support nurses with clean technique and hand hygiene. The best way to prevent accidental poisoning in a facility is to: A. Leave cleaning products under sinks. B. Store chemicals in labeled, locked areas. C. Mix chemicals to save storage space. D. Keep containers open for easy access. Answer: B. Chemicals should always be labeled and locked away to prevent resident exposure and poisoning. A resident with limited mobility is at highest risk for which emergency? A. Fire burns. B. Dehydration. C. Pressure injuries. D. Nosebleeds. Answer: C. Immobility increases risk of pressure injuries due to prolonged skin pressure and poor circulation. The CNA is assigned to a resident on suicide watch. The most important action is: A. Never leave the resident unattended. B. Remove unnecessary restraints. C. Allow privacy at all times. D. Offer sharp objects for trust. Answer: A. Safety requires continuous monitoring. Residents at risk must not be left alone. When transporting a resident in a wheelchair, the CNA should always: A. Pull the wheelchair backward into elevators. B. Push quickly through hallways. C. Leave the footrests down when transferring. D. Park facing away from tables or beds. Answer: A. Wheelchairs must be pulled backward into elevators for safety and stability. If a resident becomes aggressive and throws objects, the CNA should: A. Confront the resident loudly. B. Leave the resident and report to nurse. C. Use calm voice and maintain safe distance. D. Grab the resident to stop them. Answer: C. Calm, non-threatening approaches with safe distance help reduce aggression without escalation. The CNA is caring for a resident during an earthquake. The best immediate action is: A. Move residents near windows. B. Drop to the floor and protect residents under sturdy furniture. C. Evacuate outside immediately. D. Continue with routine care. Answer: B. Residents should be protected from falling debris until the shaking stops, then evacuation may follow. A resident's call light falls to the floor out of reach. What should the CNA do to prevent this in the future? A. Tape it to the bed permanently. B. Place it securely within easy reach at all times. C. Remove it to reduce confusion. D. Ignore it if resident rarely uses it. Answer: B. Residents must have call lights within reach to request help and prevent unsafe self-attempts. Which safety practice reduces workplace injury risk for CNAs? A. Twisting while lifting. B. Using proper body mechanics. C. Carrying heavy residents alone. D. Ignoring pain during transfers. Answer: B. Proper body mechanics, bending at knees and using leg muscles, protect CNAs from injury. In the event of a bomb threat phone call, the CNA should: A. Hang up immediately. B. Stay calm, note details, and notify supervisor. C. Announce it loudly to residents. D. Search the facility personally. Answer: B. Staying calm, recording information, and notifying the supervisor allows authorities to act safely. When using a mechanical lift, the CNA should always: A. Operate it alone to avoid confusion. B. Follow manufacturer instructions and use 2 staff. C. Skip locking the lift for easier movement. D. Place resident in quickly without checks. Answer: B. Safe operation requires proper training and at least 2 staff members for safety. The CNA observes smoke coming from a laundry room. What is the safest first action? A. Attempt to extinguish without training. B. Report and pull the alarm immediately. C. Open windows for ventilation. D. Continue working until confirmed fire. Answer: B. Fires require immediate alarm activation and reporting before any attempt at extinguishing. A resident with dysphagia is at highest risk of: A. Aspiration. B. High blood pressure. C. Falls. D. Broken bones. Answer: A. Difficulty swallowing increases risk of food or liquid entering the airway, leading to aspiration. What should a CNA do if they notice a wet floor spill? A. Ignore it if residents avoid the area. B. Clean or report it immediately and place warning signs. C. Wait until housekeeping arrives. D. Block the area with furniture. Answer: B. Spills must be cleaned or reported promptly to prevent slips and falls. During a facility lockdown, the CNA should: A. Secure residents in designated safe areas. B. Leave the building quickly. C. Allow residents to wander freely. D. Ignore instructions and continue routine care. Answer: A. Lockdowns require securing residents in safe areas as directed by facility procedures. The CNA should avoid using side rails as restraints unless: A. The resident prefers them. B. Ordered by the doctor and part of care plan. C. To stop residents from calling for help. D. To save staff time. Answer: B. Side rails can be restraints and must only be used with a doctor's order and care plan. What is the CNA's role in fire extinguisher use? A. Use only if trained and safe to do so. B. Always fight fire alone. C. Use regardless of training. D. Wait until the fire department arrives, no matter what. Answer: A. CNAs may use extinguishers if trained, but only if safe after residents are secured. Which resident is most at risk during a heat wave? A. Active young adult resident. B. Resident with heart disease and limited mobility. C. Resident who exercises daily. D. Resident who drinks water frequently. Answer: B. Elderly or medically fragile residents with limited mobility are most vulnerable to heat stress. If a resident complains of dizziness while standing, the CNA should: A. Encourage walking to build strength. B. Help the resident sit or lie down immediately. C. Ignore unless they faint. D. Offer coffee quickly. Answer: B. Sitting or lying prevents falls and injuries during dizziness episodes. A resident with a restraint order should be checked by the CNA at least A. Every 2 hours for safety and comfort. B. Once a day. C. Only if resident calls. D. At shift change. Answer A. Restraints require frequent checks, usually every 2 hours, to ensure safety and prevent complications. What is the CNA's primary role during an emergency evacuation drill? A. Ignore since it is practice. B. Follow procedures as if it were real. C. Allow residents to stay in their rooms. D. Test equipment independently. Answer B. Drills must be treated as real to prepare staff and residents for actual emergencies. Which action reduces fire risk in a facility? A. Allowing residents to smoke in bed. B. Keeping hallways clear of clutter. C. Storing oxygen tanks near heaters. D. Using extension cords excessively. Answer B. Clear hallways reduce fire hazards and allow safe evacuation. The CNA sees a resident having difficulty breathing while eating. What is the priority? A. Perform abdominal thrusts if airway is blocked. B. Offer water to wash food down. C. Wait to see if they recover. D. Leave to find nurse before acting. Answer A. Immediate action with abdominal thrusts is needed for a complete airway blockage. During winter, how can a CNA help prevent hypothermia in residents? A. Limit blankets to avoid overheating. B. Provide warm clothing and monitor room temperature. C. Keep windows open for fresh air. D. Ignore cold complaints unless severe. Answer B. Warm clothing and proper temperature regulation help prevent hypothermia. What is the first step if a resident accidentally ingests a cleaning chemical? A. Induce vomiting immediately. B. Call nurse and follow poison control instructions. C. Give them milk quickly. D. Wait to see symptoms before acting. Answer B. Inducing vomiting is unsafe, poison control and the nurse should guide immediate care steps.